Hi everyone, I am Dr. Vishnu, your rheumatology faculty at Doc Tutorials, and it gives me immense pleasure to welcome Dr. Venkat, who has secured an amazing rank of rank 80 in the recent NEET SS exam. And this time the exam was obviously it was quite wavered. It had a lot of environmental medicine, a lot of toxicology, and all of that. Those areas which are not usually studied unless somebody is focusing on critical care, etc. And to get us such a good rank in this exam, and you'll see the journey also, like it was just after his MD. So it was a great performance, Dr. Venkat, great achievement. How are you feeling firstly?
Thank, thank you, sir. I'm feeling very happy that all my hard work has paid off finally, and it was a dream come true, sir, for me.
Great. And like for our viewers, like tell me a little bit about yourself, how your academic journey has been.
I'm Dr. Venkatasubramani. I did my UG from Thoothukudi Government Medical College, sir, and PG from Madras Medical College, Chennai. And I finished my MD only in October 2025, sir. After that, only I prepared seriously. I had a strong foundation during my MD days, sir, so that helped me a lot.
Great. And talking about MD, like how was your MD? Because you cracked it through your almost through your residency only. So through your MD, how was your journey with respect to your clinics, with respect to your studying and studying of your MD for your MD exams, as well as you would have an eye on the SS exams. So how did you navigate this part?
Sir, most of the time it would be patient-based study, sir. Whatever I see the cases or the patients, I would go back to books and study them. Most of the time, that would cover each important aspect in every system, sir. And in MMC, we have plenty exposure to various cases, sir. Uh, Even this time, the toxicology part, I didn't study per se for toxicology, but however, I was trained well in toxicology, sir. We had dedicated toxicology ICU postings there, and we are continuously rotated in various super specialty departments as well, sir. So that exposure gave me the base and the motivation to read further on each topic, sir.
Great, Dr. Venkat. And like this is a classic example of how your sincerity and your work through your MD will bear fruit in your exams going forward. And I know Madras Medical College, there are dedicated buildings for each department. I know there's a specific rheumatology building in itself. And
Yes,
in
sir.
general, Tamil Nadu, there is a good focus on toxicology, be it JIPMER, be it MMC. There is good focus in the talk in terms of the academics on toxicology. So that also, because you were sincere through your MD, that has helped you. And now
Yes,
coming
sir.
to the SS, so how did you decide on that I should do SS firstly, and then I should focus on this particular subject or this particular exam? How was that decision?
Actually, I was more inclined to general medicine, sir, but the need of the hour now is super specialty. I understood it lately, and I chose the my subject of interest based upon various exposures, sir, and as well as I narrowed it like what integrates medicine is my choice like that, sir. So I narrowed it down to nephrology and rheumatology. And out of that too, personally, I liked rheumatology most, sir. So I was aiming for rheumatology right from middle of the second year, sir.
Great, and I have seen this thing also, nephrology, rheumatology. Many students have a inclination towards these both, and especially another thing binding both of these is the commonality that lot of general medicine, it's like an extension of internal medicine.
Extension,
So that
yes,
is,
sir, yes, sir.
yeah. So that is that a thing that is very common. Then coming to, once you decided NEET SS, INSS, these are the two options that we usually have. And this time there was a lot of confusion. First there was NEET SS before INSS, then it got postponed, like many times it happens. So students always have this confusion. Even you would have gone through this, especially during this
Yes, sir.
September October period. How did you deal with this part of things?
Actually, I had exams until 30th of October, sir. Yeah, my MD exams. So last 2 months, I was focusing completely on my MD exams and practical exams, sir. And those foundation, the topics I read helped me in general medicine, sir. But however, I was not more into the approach of solving MCQs. Only after the my MD exams, I was solving more MCQs for this NEET SS pattern, sir. In rheumatology, I was interested in right from second year, sir. So I attended some quizzes and attended competitions in rheumatology, sir. That helped me a lot in focusing rheumatology. And I used to read standard textbooks of rheumatology whenever I get time, sir. And after this general medicine, my board exams got over only. I prepared intensively for the INI as well as NEET assessor. First, I approached like I have 3 weeks for INI after my MD exam. So I focused completely on INISS for the 3 weeks and gave my INISS. So I was like in the my mindset like whatever I can do my best, I will do my best and not worry about the results. And I did INISS quite not expected to my level, sir. So I swiftly focused on my NEET SS preparation. And I had 1 month after INISS exam, sir. So I planned like 3 weeks for revision and 1 week for 3 weeks for first read and 1 week for revision, sir. So that approach helped me. And I didn't stop like in any day or any time. I didn't stop reading, sir. So whatever I was able to do, I just focused on that. I didn't focus on the results at all.
Yeah, I think I'm sure Venkat would be a great fan of MS Dhoni, and he's going in those lines like focus on the process, stay in the present, and don't worry about the result. The result will take care of itself. And he's like throughout his MD, as he's telling, he was giving quizzes, going to the clinic, studying about the patient, staying in the moment, and doing what is best in that particular phase, and that will bring fruit. And even in such a turmoil period of NEET versus INSS, he had the very clear plan. Firstly, he did his MD exams very well, because that thing helps in your INI as well as NEET. I'm sure your NEET SS
Yes, sir.
preparation, most of the thing would be done in the MD exam preparation, right?
MD,
And you are
yes,
just
sir. Yes, sir.
revising it.
Of course.
And even the general medicine part of the INI you have done in the your MD exit exam, and you had that good
Yes,
window
sir.
of 3 weeks where you could focus on rheumatology. And that is what we usually say. And you already had rheumatology studied before as well for your, as you was telling, IRACON quizzes, etc. you were giving. So you had a
Yes,
very
sir. Yes, sir.
specific plan. At the same time, you were flexible with the plans and immediately executing it without wasting any time. As you were telling, you were continually reading. So very
Yes, sir.
inspirational journey, Venkat. Now, coming to
Thank
your
you, sir. Thank you.
specifically preparation, like with respect to INI, how did you prepare? What sources did you use? And coming to the NEET SS as well.
Sir, since I had very short span for intense preparation, I focused first, only the previous year topics, sir. I used to watch the previous years of INSS rheumatology done by you, sir. I watched all the modules and made a list of topics that are asked in the exam and read in depth about that, sir. That is what I did first. I gave priority to that first, sir. And INSS, I made some notes in from Kelly also during my PG days, sir. So that I used for INSS. And for NEET SS, also I did the same, sir. After INSS, I sat for 1 day and solved all the PYQs of NEET and got to know about the where they exclusively ask. However, NEET SS, we can't predict the topics, sir, but the approach we can predict, sir. So mostly they will ask like the close differentials and next step of investigation or best investigation. So pathophysiology, epidemiology, they most likely they won't, they are not asking now, sir. So the basic approach to a problem, clinical problem, and the management is what they are expect to us to answer, sir. So I focused on only that approach, sir.
Great.
Then
And
uh,
like,
then I did. Oh,
yeah, yeah, continue.
sir. So then I just read the PYQs topics. In addition to that, I added whatever the lateral topics connected to that I added, sir.
Yeah, I think you had this very good understanding of the exams. I think INI, you can predict. You have to obviously read about it, but there are a lot of repeat topics and lot of
Nice, sir.
repeat concepts that keep happening, and that is why the pyqs help a lot. In neat assess, although pyqs do help, but to be very honest, the repeating thing is little bit less in neat assess. It is
Yes, sir.
nowhere near the
Yes,
level of the INSS. Neat assess,
yes, sir.
what will help you is your baseline knowledge, because there is this unpredictability about the exam, so more baseline knowledge you have, the better it is. And also obviously qbank practice, which is very important. Then
Yes, sir.
coming to our help, like what are the modules that you used in doc tutorials? What did you feel were very beneficial for your juniors?
Sir, the PVQs videos were very, very helpful, sir, in rheumatology. And I did only QRP videos for NEET assess, sir. Those were very, very high yielding, sir. In each subject, only 2 to 3 hours of most important topics were discussed, sir. So even out of the 150 questions, 100 questions we would have covered from that QRP video, sir. That was very, very helpful. Last 1 week only I watched those videos. I was like passively watching while having a breakfast or something. I didn't actively listen, but that helped me a lot, sir. Actually, in solving the MCQs and approaching a clinical problem. That was a short, sweet, crisp, and high yielding videos, sir.
Yeah, actually we
And
made the
GTs
qrp videos. Yeah, yeah, tell me.
and GTs also were kind of mimicking the exam patterns, sir. I solved the previous year question, and I came to know what they usually ask and what approach they usually tend to have in the exam, sir. So that helped me a lot.
Yeah, I think QBank and GT's our team is excellent. I think we're easily the best. I would say, like, I would go on to say that it is the best. And even the QRP videos are something that all the students like, because they obviously, because you have to focus on your reading, which takes major part of your day, and you can use QRP as a support system. So coming again
Yes, sir.
to your guidance for your juniors, because juniors are the main people who would be listening to your words and your guidance. So what would you advise them through their MD, at the time of their MD exit exam, and for the SS?
Sir, for MD, if they focus on the clinical cases they see and they read more about it, they can get a solid base, sir, in any specialty. And regarding exam preparation, we must know the previous year topics and the exam pattern and the approach they usually test for in the exams, sir. And what I advise juniors is don't worry about the results. You keep on consistently working hard. The result will definitely yield one day, sir.
Very nice advice, Dr. Venkat. And like before we go, obviously the main, the result is standing on your efforts, but also there'll be a support system to hold you. So whom would you like to thank before we take leave?
Sir, I would like to thank my parents, sir, especially my mother. She helped me a lot, and my elder brother as well, sir, and my father also. They were the support system for me, sir, and my friends also from UG days, and my batchmates who supported me throughout this journey, and my professors and chief of my PG college, sir. So they were the
Great.
support system. They actually believed in me more than myself, sir.
No, like, yeah, look, seeing your personality and talking to you, you are always bound for success, and I'm sure you will do great in the coming years also. So thank you, Dr. Venkat, for
Okay, sir.
speaking to us. It was very
Thank you. Thank you.
nice talking to you.
Thank you. Thank you, sir. Thank you, sir. Thank you so much.